COVID-19, packaging of diagnostic samples for onward transportation. This resource describes the required steps for the packaging of samples for COVID-19 being transported for the purpose of diagnostic testing. This process will help to prevent contamination of the healthcare worker and the environment. Please note, in order to carry out these processes, practitioners must ensure appropriate personal protective equipment is being worn. Details can be found at the Health Protection Scotland COVID-19 Packaging of Diagnostic Samples for Onward Transportation landing page. Personal protective equipment will now be called PPE. For the purposes of this resource, it is assumed that the diagnostic sample has already been obtained using locally agreed sample containers, for example swabs in an appropriate transport medium. It is the responsibility of the person collecting the sample to ensure it has been appropriately labelled with patient information. This should include patient name, date of birth and CAI number, as well as the time of sampling, the location the sample was taken and the specimen type as a minimum. The order for packaging the sample is critical and must be followed. The types of packaging shown in this webcast may differ from the packaging available in your health board, but the principles remain the same. The required packaging consists of absorbent material, plastic sealable specimen bag for each sample container, packing material, for example bubble wrap or polystyrene packing material, a rigid secondary container which is leak-proof and can withstand 95 kilopascals internal pressure. This may be a plastic screw-top jar with O-ring, an outer box, appropriate external labels and indelible ink pen to complete these if they are not pre-printed. Details relating to request forms. All request forms should be completed in full, away from the sample processing area. The form should be placed outside of the secondary container. Forms should not be placed in the bag with the sample. COVID-19. The correct order for packaging a diagnostic sample for onward transportation. Before packaging the diagnostic sample, the healthcare worker should already be wearing appropriate PPE. The PPE required may be different depending on whether you are working in the laboratory or in direct contact with patients. Details can be found at the Health Protection Scotland COVID-19 Packaging of Diagnostic Samples for Onward Transportation landing page. We will now demonstrate the correct order for packaging a COVID-19 diagnostic sample. Step 1. Preparation for packaging. Ensure you have all the required components for packaging the diagnostic sample. The outer box and diagnostic test request form should not be taken into the sample processing area. For example, they should be placed in a separate area of the laboratory or kept outside the patient room. The request forms should be completed in full before the sample is packaged. Step 2. Decontamination of the outside of the sample container. Ensure the lid of the sample container is tight. Decontaminate the outside of the sample container by wiping with a locally approved detergent disinfectant solution. Further details on the requirements of decontamination for COVID-19 can be found on the HPS website in guidance documents for laboratory and infection control. Links have been added to the title page of this video. Step 3. Placement of sample container in a sealable bag. Wrap the sample container in enough absorbent material to ensure that any leaks will be contained. Place the wrapped container in a sealable specimen bag and seal. Only one sample should be added to each sealable specimen bag. The request form should not be placed into the specimen bag. Change your disposable gloves as they should be considered contaminated. Dispose gloves as Category B clinical waste. Step 4. Secondary container. Place the sealable bag in the secondary leak-proof container. More than one sealable bag can be added to the secondary container, but it must not be overfilled. Pack the container with, for example, bubble wrap to prevent movement of sample container during transit. Samples for other tests must not be included in this container. Decontaminate the outside of the sample container by wiping with a locally approved detergent disinfectant solution. Further details on the requirements of decontamination for COVID-19 can be found on the HPS website in guidance documents for laboratory and infection control. Links have been added to the title page of this video. Step 5. Outer box including labelling. Add the secondary container into the outer box. Required request forms should be completed and placed inside the box but outside the secondary container. The following information should be added to the outside of this box. A UN 3373 label, minimum 50mm by 50mm. This is usually pre-printed on the side of the box. Recipient name and address. Sender name, address and telephone number. Tamper-resistant seal. If tamper-resistant seal is not available, then sellotape should be used to seal the box. Priority 10 marking. The package is now ready for transportation as per local arrangements. Remove gloves and perform hand hygiene. Further information can be found on the Health Protection Scotland COVID-19 Packaging of Diagnostic Samples for Onward Transportation landing page. Thank you.